For millions living with autoimmune disease, relief can feel out of reach. And today, Dr. Sayeef Mirza is here with us, joining us from Moffitt Cancer Center to share how advanced immunotherapy is helping reset the immune system and opening the door to long-lasting relief and a better quality of life. Thank you so much for being here, Doctor. Appreciate it.
Thank you so much for having me.
You know, I feel like when patients get diagnosed with autoimmune, number one, it's scary, and number two, they're often told there's not much you can do about it. You just have to manage it. But there are these new immunotherapies, and that's changing the game. Can you explain more?
Absolutely. So yeah, autoimmune disease is a dysfunctional immune system, an immune system that attacks yourself. And so what we've done in our cancer center, when an immune cell becomes cancerous, it grows rapidly, and you treat it with chemotherapy. But some autoimmune diseases, these immune cells, instead of growing rapidly, they just don't work as well, or they're attacking the own patient, attacking ourselves. And so the same type of treatments could be considered potentially curative or treating these patients with autoimmune disease, whether it's treatment with immunosuppressive therapies. This is what the current paradigm is, in which patients with autoimmune disease have to take medicines for a long period of time, chronically, indefinitely, that just weaken their immune system. But with new therapies, immunotherapies, we could target specific parts of their immune system, have a less toxic approach potentially, and potentially reset the immune system and cure them of the autoimmune disease.
So you're seeing these immunotherapies work as they're supposed to. Can you elaborate a little bit more? That's amazing. They're able to target rather than just suppress the whole immune system.
Exactly. So we have trials at Moffitt Cancer Center. These are CAR T trials. So this is a chimeric antigen receptor T cells. So this is genetically engineering your own immune system to fight the specific part of your immune system that is causing those antibodies to attack you. So these are B cells that are producing the antibodies that cause the disease. And so in lymphoma, these B cells are becoming cancerous, but in an autoimmune disease, the B cells are making antibodies or autoantibodies. So these patients with lupus, myasthenia gravis, these specific immune cells that are essentially B cell mediated, B cells making the wrong type of antibody against yourself, these CAR T cells can deplete or get rid of those B cells specifically.
Who is an ideal candidate for these types of immunotherapies?
That's a great question. So autoimmune disease oftentimes can be treated with first-line, second-line therapies, but as soon as a patient is not responding or they're refractory to the common standard treatments out there, this is when a clinical trial with CAR T-cell therapy could be potentially curative.
And how do you get those services? I mean, I have to tell you, before talking with you today and finding out about this particular segment, I wasn't aware of all the treatment that you offer at Moffitt for autoimmune. So that's exciting in and of itself. But how do you receive these services? What do you need to do? What's the next step for someone who's saying, oh my gosh, this could help me?
So there's different autoimmune diseases and they all behave differently. So every type of autoimmune disease has to be considered in a different light. So we have stem cell transplants for specific autoimmune diseases such as multiple sclerosis and systemic scleroderma, systemic sclerosis, and then we have CAR T-cell therapy for lupus and myasthenia gravis, and those lists will continue to grow as we continue studying the evidence behind it. And so when a patient has these type of autoimmune diseases or other refractory autoimmune diseases that don't respond to their therapies, they can reach out to their rheumatologist, their neurologist, have that conversation, and go on our website and start that conversation, that discussion, so that we can get these patients in and see them soon.
That's great news. Thank you so much, Doctor. We want to share some more information with our viewers now. There you go. Of course, the website and the number to call. We love having Moffitt Cancer Center here in our Tampa Bay community, such a great health resource. All the best to you.
Thank you.